Heroin. We all know it's a problem.
But did you know?
It kills 23 people in Ohio every week.
The drug takes more lives in Ohio each year than homicides,
Suicides or car accidents.
And 1 in 8 people who try it
Will become addicted.
This is not a black or white problem.
it's not an inner city problem.
It's a problem that affects us all.
Learn how to spot the signs.
and help Cleveland 19 fight opiate abuse in our community.
For more information, click the Your Health tab on cleveland19.com or call 211 for immediate help. Every TV station in Cleveland is devoting the next 30 minutes of commercial-free programming to shine a light on a growing, deadly problem in Northeast Ohio: opioid abuse. Kids, adults, grandparents, babies, friends, neighbors, co-workers, us. From Cleveland 19 News, this is a special report. Know the risks, a look at opioid abuse in our community. If this special presentation helps save just one life, we've accomplished our goal.
So where do we start? Eye to unflinching eye with some of those people who have been touched with this growing epidemic.
But first, if you or someone you know needs help, go to cleveland19.com and click on Spot the Signs under the Your Health tab. And for immediate help, call 211.
In Northeast Ohio, we're facing an epidemic like we've never seen before. Heroin use is not only on the rise, but it's taking lives at unprecedented levels, and it's not slowing down.
What I see in my office is the tip of the iceberg of this problem. I wrote heroin on more death certificates than I did for car accidents, than I did for suicide, or for homicide.
Our leading death was motor vehicle accidents. That is no longer the case. The leading death in our county is heroin.
It's the #1 public health issue we face in this country. It's the #1 killer. It's the #1 impact on business. The list goes on and on and on.
This new addiction is something different. The grip of this addiction is different. I've never seen anything like it.
Well, the current heroin epidemic that we have here in Cleveland and in Northeast Ohio is certainly worse than any epidemic we've had before. The heroin is more pure, the heroin is more available, and there are more people with opiate problems because so many people got started on prescription opiates, began to abuse them, and now find they can't get enough prescription opiates for their habit, and they're turning to heroin.
I have seen the statistics, I've heard the horror stories, I've been to funerals, 16, 17, 18-year-old kids who've died in my district that I go to try to support the families, who are devastated. They'll never recover from the loss of their child. This problem scares the heck out of me.
My name is Lexi and I'm a recovering heroin addict. It all started when I was 7th and 8th grade. You know, I started drinking and smoking. Sophomore year, I started doing pills, which led to heroin, and then I started using the needle. It starts out as, harmless fun, I guess, of teenagers, experimenting. And then one day you get offered something harder and you're like, okay, why not? Like, I'll try that. You're not yourself. You're a completely different person. You turn into a liar, you turn into a thief, you manipulate people. That was my life. I was miserable every single day. I mean, you do nothing but chase a drug all day long. It's no life for anybody.
If people don't get treatment, the majority of people die, and they die early.
My eldest son, Robbie, had his wisdom teeth out between his freshman and sophomore year of high school. And when he had the surgery, post-operatively, he was prescribed prescription pain medication. So we worked really hard to ensure that he was off the pills in 2 days. I've got this new drug. It's just as good and it's a lot less expensive. And Robbie's thought process then was, well, I'm clean, I can do it once, I'm in control. And that new drug was heroin. And within 2 weeks, he was fully addicted to heroin. And then October 20th, 2011, I was driving home from work. I was in Michigan, and I got a call from his mom around 2 in the afternoon, and she said, have you talked to Robbie today? Work called, and he took the work truck this morning at 10 to go out and make deliveries, and they can't find them. They can't get a hold of them. It's weird that you're almost like hoping that there's a car accident or something happening, he's in the hospital, versus using drugs again. We knew that for whatever reason on that day, the drug had called his name again, and he had said yes on that day. And they got a phone call from the East Cleveland police, and letting them know that they'd found my son, and that he passed away. And so I had to leave the police station. I had to go home and tell his mom. And then we had to go to school, tell his brother and sister. And 3 days later, we buried him. And, 6-month journey with heroin.
The victims of addiction come from all walks of life, young and old, rich or poor, white, black, male, female. Many share the same gateway into the secret world, prescription drugs. Danny Carlson explains just how easy it can be.
It's a story we've heard over and over again from those in recovery talking about their own journeys.
My freshman year is when I started the pills and like Axes and stuff like that. And then I think it was my sophomore year when I first tried heroin.
By the time I got addicted to, really addicted, couldn't help myself, couldn't stop, to painkillers and heroin, I was about, I want to say 22.
And from those left behind when addiction takes another victim.
The hardest part about this is that they are your child, and you know who your child is, and they've changed.
We're almost like the living dead because we live it every day.
Each story is different, yet similar.
9 times out of 10, when I'm talking to someone in recovery, they say, I got addicted because I started using prescription drugs.
That's right. I would say universally, that's the story.
So how, in the midst of this epidemic, can you protect yourself and your family? Dr. Christine Alexander, the family medicine chair at Metro Health, says first, there are a couple of types of drugs you need to be aware of. Prescriptions used for anxiety, the barbiturate class of drugs. We're talking about things like Xanax and Valium. Prescription stimulants are also a potential concern. Those are things like Ritalin and Adderall. And of course, opiates like OxyContin, Vicodin, and Percocet. Abuse of these narcotics is the most likely to lead to heroin use.
Having those narcotics around, it is like having a loaded gun, and really should be thought about in a very, very similar way.
She recommends going through your medicine cabinet a couple of times a year and deciding what you need and what you don't. And she says you should get rid of those painkillers that you don't need anymore and not hold on to them just in case, like a lot of us do.
We're in the middle of an epidemic. If we weren't in the middle of an epidemic, then I would say, okay, maybe it's not so bad to hang on to it. And 5 or 10 years ago, I would have said, that's great. We are in the middle of an epidemic.
And if you do need to have prescription pain pills around, she says you need to take extra steps you might not have had to 5 or 10 years ago because you never truly know who has a problem.
It's an epidemic, so we need to be extra cautious. So maybe get a lockbox, maybe keep the medicines in a lockbox, because you just don't know who might come into your home.
This haunting image shared by social media started a new conversation about addiction in today's digital world. It uncovered what was for so long hidden in the shadows of opioid abuse. Jen Pachano showing us how social media takes what used to be a private battle and puts it in front of millions.
Tug Massa has 5 years of sobriety. He realizes that social media can provide easy access to drugs or enable addicts. But more importantly, he thinks it's an extension of the recovery community.
You're struggling, you can reach out. There's people on there that are there 24/7 that will answer your messenger, or that you can post on their page, or there's numbers and there's resources that can help somebody.
James Murphy is just 2 days clean.
I mean, I don't feel the greatest, but I feel good that I'm doing the right thing.
He was an active heroin addict for a decade and left a lot in his wake.
Kids, I don't see my kids.
He's living minute to minute and says social media like Facebook Live broadcasts are helping him survive.
Late night talk with, the F Heroin Foundation's late night talk. I met a lot of good people there.
Murphy says the community he finds through Facebook helps combat the isolation.
It's hard to sleep sometimes at night. The withdrawals and all that, it's rough to sleep. So, they give us something to do at night if you're lonely and you ain't got no one to talk to.
In fact, that social networking helped him land a scholarship to a treatment facility in Fort Lauderdale, something he couldn't have done on his own.
I'm tired of that life.
Alicia Monaco works with youth in recovery at New Directions. She knows there are still risks when it comes to social media activity and addiction, especially in the early stages of recovery.
Some of the kids that we work with will follow different accounts when they're using, and when they go through treatment, they need to clear out those accounts so that those triggers aren't there when they're leaving our treatment.
As the heroin epidemic wages on, the images of addiction pile up, many of which have gone viral. Monaco says those can help by starting a conversation.
It allows people to begin having really tough conversations given a really unsettling image.
Massa and Murphy think they can also be quite damaging.
Because it creates a stigma, and these people are afraid to come forward because they don't want to be known as the junkie or the person that's using drugs.
Those in the recovery community know those images and footage last forever and can really hurt the loved ones who are trying to help an addict. Monaco believes the jury is still out on whether or not those encourage or discourage addicts from seeking help. New Directions is currently testing an app for its youth clients to provide 24/7 support. It's its first opportunity to provide a specific social media tool for recovery.
The app allows people to connect via texting. It also has what's called a beacon button that can be pressed if there's a crisis going on.
The social media aspect of recovery is something former addicts value, along with other tools they use to stay clean one day at a time.
So I'll stay in touch with everybody that I meet, all that, because they help me. Seeing these guys, he has 5 years, Kane has 4 months. That's inspiration for me.
Life is so much better. My best day high is never going to be as good as my worst day sober.
For Know the Risks, I'm Jen Pachano with Cleveland 19.
Two remarkable women, 2 battles with addiction, and 2 stories of how they beat the odds. Now Nicole Versansky has their stories.
For those who said,
I would never be anything better than a junkie,
Nicole Walmsley, a former heroin addict, is making it her life's mission to prove them wrong.
Who cares what people think of who we used to be? We can recover. I've seen it. It happens every single day.
Nicole, now 4 years clean, is one of the driving forces behind bringing police-assisted addiction and recovery initiatives to Ohio. She read about the program 2 years ago in Massachusetts. Addicts were turning themselves into police, facing no charges as long as they entered recovery.
Why can't Ohio have that? I blindly reached out to the chief out there, and then he flew me out there and trained me, and then on my own time I went to 50 departments in the state of Ohio to see if anybody would listen to me.
Berea and Olmsted Township are 2 of the local departments that did listen.
She was the catalyst for all of that.
The department started the Safe Passages Initiative in August. This is one of the intake forms. To date, they've helped more than 60 heroin addicts enter treatment.
And we have now 20 departments and placed over 200 addicts into treatment.
And she brings a lot of heart and passion to her job.
And to her, this is a calling.
Nicole's passion for helping others travel that road to recovery comes from knowing the struggle herself.
It changed something inside of me that made me feel good.
Nicole's addiction started at age 19 after a medical procedure when she was prescribed pain pills.
And it was shortly after being prescribed I started abusing them.
Those pills led to heroin. In 2013, she overdosed. It scared her sober. She turned herself in. Being locked up was her best chance for recovery.
That's why I believed in the Safe Passages program on turning yourself in, because if you're going to go to these police officers for help, then you're really desperate.
Caitlin Doherty knows that desperation as well, hooked on heroin and pregnant. Caitlin and Nicole's paths would cross this past summer. Caitlin was the first person to turn herself in to Berea PD under the Safe Passages initiative.
I wasn't hurting only myself. I was hurting somebody else now.
Nicole knows firsthand how quickly that door of opportunity can shut. Minutes count.
She was withdrawing, so she was very agitated, hated the world, hated me.
And placing Caitlin was a challenge. 3 area facilities turned her down in the first few hours because the risk for miscarriage was too high. A recovery home in Cincinnati finally came through.
And they had to keep her on methadone until the baby was born and then detox them.
Baby Bella was born this past October, 5 weeks early. She had a twin that did not survive. So far, Bella has been eating, gaining weight, and doing well.
It's awesome. It really is. I have my life back.
At a We Do Recover fundraising event in January, Caitlin reunited with Nicole.
She saved my life.
And with Berea police officers. It was the first time they've seen each other since Caitlin entered recovery.
Good to see you. Thank you.
No, I'm so proud of you. I'm so happy for you.
Thank you.
I'm sorry. I told you, no one came for me. No one showed love or compassion in my addiction. So it's very important for me to love others.
For Nicole, her work with Caitlin and with numerous others is therapeutic.
When I put other addicts into treatment and they come out and they succeed and they're with their families, it keeps me going and it helps me stay clean and keeps me on the right course.
You know, we live out here in this suburban, nice, comfortable bedroom community, and I make a sizable income, and my kids go to a nice private Catholic school, so I don't have to worry about their drug use. We have to get away from those kinds of things.
There was this stereotype, I think, at one time that our typical drug addict is somebody who's inner city, isolated, in poverty, and that's completely inaccurate from what we see.
Heroin addiction is a non-denominational taker, and it'll take anybody from anywhere. And then it'll take every day whatever a person can give until a person decides to get sober.
The face of addiction is really the face of America today.
I think from a parent's perspective, this problem has gotten bigger because we're not as smart as we think we are. I remember sitting down with some law enforcement officers that deal with this every single day, and they explained to me very clearly that the knowledge hierarchy is the dealer, the kids, the police, the parents.
We're on pace, unfortunately, to double the number of addictions this year as compared to last year, and last year was horrific. I mean, sadly, Ohio is one of those states that's hardest hit, but it hits everywhere. It knows no zip code. It doesn't discriminate.
You know, if we had a plane crash in Lake Erie right outside the stadium and 500 people on board were dead, they suffered that ultimate tragedy, it would be all over every news channel in the nation. But yet here we are in the state of Ohio, and we're burying kids every single week. Every single one death of a 16, 17, 28, 29, 42-year-old father of 3, every single death impacts the people.
It's all of our problem. It's not just our neighbor's problem. It's everybody's problem.
Now we're getting answers from two of our state leaders, Senators Rob Portman and Sherrod Brown. Working together across the aisle, they both know this isn't a partisan issue. It's an issue of life and death. They've been on the front lines of this war and know what it takes to turn the tide.
Senators Portman, Senator Brown, one of the big things that I at least notice about this issue is in an era of seemingly increasingly partisan politics, this is one issue that you guys are firmly together on, this issue of attacking the opiate epidemic.
No, Danny, this issue of combating substance abuse generally has typically been a bipartisan issue. I would even say a nonpartisan issue. And particularly now, we've got a crisis facing our state. And Sherrod's introduced some legislation, I've introduced some legislation, but we both worked together on various bills, including the Comprehensive Addiction and Recovery Act, which is now law, and the Cures Act. And it's making a difference in Ohio. It takes a while to get these things implemented, so they're just getting up and going now. They were passed last year. But we need the help badly. And the most recent problem we've got is fentanyl, which is this synthetic heroin that's coming into Cleveland and other cities. In Cleveland, as an example, in the last 10 months, we've had more overdoses from fentanyl than in the previous 10 years. So this is a new crisis that Sherrod and I are working together on.
We've seen in every part of the state, in the cities, in the suburbs, in Appalachia and Western Ohio, everywhere, where unfortunately Ohio has more opioid deaths than any state in the country. The two bills that are now law, coupled with the bills that Rob has introduced as the prime sponsor and I've introduced as the prime sponsor, dealing specifically with fentanyl, we hope will make a difference. And we're seeing that kind of bipartisan cooperation. We're also seeing increased attention from local and state governments. That's part of our effort from Washington to establish those partnerships with some dollars to do what needs to be done.
There will be some people who watch this piece and think this Medicaid expansion, people addicted to opiates, this does not affect me. Why should I care about this? What would you say to that person?
It's the biggest public health threat in our state, and I don't know, maybe in our lifetimes, certainly, and it's one of the biggest in our lifetimes, and we can't walk away from it just because some people say we should. It matters to far too many families, and it matters to the whole social fabric of the state, ultimately, if we don't arrest this terrible, terrible opioid epidemic.
Danny, I would say that there is no issue that affects us more day to day as Ohioans right now. And I would challenge you to go to any county in Ohio where they don't say it's the #1 cause of crime. I ask sheriffs and police chiefs this all the time and get the same answer. So this crime is affecting all of us. If you go to your local fire station, ask the firefighters there whether they do more runs for applying Narcan to overturn the effects of an overdose or whether they do more fire runs. They'll tell you they go on more heroin runs. We're all paying for that. So this is affecting all of us. It is gripping our state. It is destroying communities. It is breaking apart families. It is causing enormous crime. So we need to figure it out. And by the way, it's not going to be solved here in Washington, D.C. We can help to be better partners, and that's what Sherrod and I have been trying to do with our legislation, some of which is now passed. But it really is an issue that's got to be solved at the community level and ultimately in the hearts of our families and individuals. We've got to turn this around before it's too late.
You guys were talking about the federal level, but then also needing partnerships in state and local levels. Wanted to see what you both thought of Governor Kasich's new rule restricting painkiller prescriptions.
Here's the reality. This problem came to Ohio first as prescription drugs. There's no question about it. And it has grown, no question about it. And sometimes it's from an accident or an injury. In other words, somebody who's actually given a prescription to take care of a problem, and then they become physically addicted. Sometimes it's abuse of the drugs. At one time in Ohio, not too long ago, we had as many prescriptions being filled in Ohio as we had people. In the last 10 years, we've made progress. We've cut back a lot. We've cut back about 20%. But still, there is overprescribing. And we need to get the medical community and the pharmacists and everybody else engaged in this. And most doctors who I talk to and pharmacists I talk to want to be part of this fight. They really do. They understand the devastation because they see it. So this is happening in our state, and it continues to happen, although we're doing better. And so I think his rule and additional efforts at the federal level on these drug monitoring programs are, unfortunately, these are absolutely necessary.
It's a small minority of doctors, a small minority of pharmacists that have overprescribed and oversupplied the pain medication that's later led to heroin addiction. So we need not to point fingers at people, but to make sure everybody's responsible along the whole chain of addiction.
The good news is this is treatable.
It's an immediate problem that needs an immediate solution, but it also needs a far-reaching strategy going forward to mitigate it down the road.
Congress is finally taking action. The CARA legislation, Comprehensive Addiction and Recovery Act, and what we've come up with is a way to look at this issue a little differently, to acknowledge, really for the first time by the United States Congress, that addiction is a disease and needs to be treated like that, like other diseases.
It's going to take all of us working on the same page to drive the education and awareness that's needed to beat this issue. And if we don't all come together, then the drug's going to win.
If you're going to support this campaign, part of the adding up means it's got to be for the long term. It can't be for the short term. There is no quick fix for this.
When the drug becomes everything, all of us suffer, not just the addict, the family, the community, the entire state. That's why this campaign is so important.
We need this, and we need this now, not tomorrow.
And over the course of the last 3 years, we've spoken to over 40,000 people, and it's taken us 3 years, to get to that many schools and organizations. In one night, this project has an opportunity to send a message to over 1 million people. We reach more people in one fell swoop than we're going to be able to reach in the entire existence of our organization.
This is really, really very important to me. It's been a really big part of my life, and if I can do anything to even save one person, sorry. I don't like this. If I could just help one person to turn their life around, it would be amazing for me.
We've reached the end of our show, but it's not nearly the end of what needs to be done. At Cleveland 19 News, we're committed to continue to ask those tough questions and to get you answers about opioid addiction.
And as a community resource, you'll be able to find these stories as well as other key points of information on our Spot the Signs page on cleveland19.com.
Let's work together and help rid our community of opioid abuse.
Thanks for watching.